Consultant obstetrician and gynecologist Dr. Cathy Maddan shares how the diagnosis affects mothers.
One thing we see often, hypertensive disease in pregnancy. The other one is diabetes. It can put a patient at risk for gestational diabetes in pregnancy. And so those are the two common pregnancy-related illnesses that you can see as a result of their mood disorder.
A 2021 study by the National Library of Medicine says anxiety and depression can cause imbalance in the hormone levels of the body, thus resulting in glucose imbalance. Additionally, their 2020 study shows that life stressors increases the risk of gestational hypertension. It may also affect the baby.
Because of that, that can trickle down to the fetus. So it can affect growth of the fetus. The mothers may have a growth-restricted fetus, so that baby comes out smaller than the average baby at that gestational age. And sometimes because the growth is quote-unquote stunted, you are forced to deliver a premature baby because the environment in the uterus has now become unfavorable. So it can cause a problem with growth of the baby. It can force you to need to deliver this baby prematurely. And prematurity has all the problems with breathing, maintaining temperature, and feeding.
Additionally, children of women who suffer from untreated postpartum depression may have behavioral problems and may develop sleeping and eating disorders. Dr. Maddan says the effect of antidepressants on pregnant and breastfeeding mothers can vary.
Some of these drugs are okay to take during pregnancy or during breastfeeding with very little harm to the infant. And some of them are definitely not drugs that you should be breastfeeding with. Of course, the psychiatrist is going to try and choose the best drug that has the least effect. Ultimately, it's dependent on what is deemed necessary based on the mother's situation. And so you might have to tell them, these are the risks. And given that you have to be on it, then maybe you need to not breastfeed.
The U.S. Food and Drug Administration recently approved the use of a new drug, Zurzuvae, for postpartum depression. It is said to work immediately if taken for the prescribed 2 weeks. Research is, however, unavailable on the effects of the drug on breastfeeding mothers and the babies themselves. And the price tag?
$16,000. And it's unclear at this time if or how much insurance will cover.
CBS reporter Tracy Smith. And that $16,000 is over 2.1 million Jamaican dollars for the 2-week treatment plan. But there is a less expensive option. Jamila tells us why getting professional help is important.
I just didn't understand what I was going through. I knew that I was depressed and sad and angry and everything, but I just needed somebody who was logical in thinking and who I guess would have, spoken to other persons like this to advise me the best way possible and to give me exercise and activities to do to get me out of that. It's a positive thing just to know about all of these things because, once you're aware, you can get help and you know how to navigate better in terms of, your actions, your reactions, how you speak, how to manage your child as well, which is a very, very big part of it, because when we sad and we're depressed, sometimes we tend to take out our anger or frustration on the thing that we love the most, which is our child. But thankfully, as I said, I was seeing a therapist, so I was pretty grounded in whatever she was telling me.
Phil, on the other hand, was ashamed of seeking help.
There's a shame factor in having it, especially as a man. You're supposed to be the strong one. You're the father figure. You're what your child is supposed to be. So to admit that I potentially wanted to hurt my child and all those things, that's not something that you would want to admit to anyone, especially your parents, who they went through that for how many years, and I'm just a few months in, and I just want to be done with it,
Associate Clinical Psychologist Deborah Smith says that stigma may be the reason she has never treated a new father. She, however, provided information on the various treatment options.
Depending on the intensity or the severity of the symptoms, it can either be just psychotherapy or a combination of both psychotherapy and psychiatric care. Because sometimes medication is needed to get the symptoms under control. The psychological part of it teaches the mother some coping skills and also provided her with a safe space that she can freely talk about how she's feeling without being judged.
She also gave a breakdown of those coping skills.
Relaxation exercises learning to put your mind and your body in a relaxed state, less stress on your body. Another one of the coping skills is to learn to live in the present. One of the things that can cause severe anxiety during pregnancy is to focus on the possibility of what can happen. Another thing is to learn how to prioritize tasks, create a schedule for the day. This is also going to be very helpful, especially when the baby is born. Also learning to take time to take care of yourself. Teaching self-care practices is going to be important, not only for the mother, but also for her partner if she does have one.
Given the likelihood and the factors, is screening for depression an integral part of prenatal care? The American College of Obstetricians and Gynecologists and other medical bodies around the world have guidelines for prenatal screening for depression. Additionally, the World Health Organization has advised that maternal mental health be integrated into general health care. Dr. Cathy Maddan says Jamaica does not have similar guidelines.
Unfortunately, we don't have anything like that instituted locally. Most of us and most persons out in the public forum would, as physicians who deal with pregnant women, would go off of clinical acumen. So you notice a difference in the patient's attitude. You pick up based on the interview that there are a lot of things happening that may be weighing down on them. And we go off that hint rather than using a formal screening tool.
Dr. Maddan added that even with the greatest clinical acumen, years of experience and the pressures of the job, there can be misses. She says although she has treated a small number of diagnosed cases, the true number of women with depressive symptoms may be much higher, especially in the understaffed public health system.
Particularly in the large hospitals like Spanish Town Hospital and the Victoria Jubilee Hospital, you really have to be moving fast from one patient to the next to actually get to see everybody at the clinic so that nobody goes back home without having been seen. And so, yes, it's easy to have that as a reason that we can't zone in on that too much. But with the advent and the introduction of electronic medical records, that might make it easier. You ask the questions and it gives you an automated score rather than you trying to calculate it. And that would slow you down. It also forces you to do it because you have to do it to move on.
Minister of Health and Wellness Dr. Christopher Tufton explains how the new system will help.
There is an overhaul taking place in the public health system, one element of which is the life stages approach to health care, which means when one enters the system, whether through a primary health care institution or otherwise, there are some added procedures that a doctor will examine for. And in the case of expectant mothers, they will go through a series, both pre and post, which I think will capture some of the signs of postpartum depression.
And work on the electronic health records system is progressing.
The electronic health record system is being rolled out. Maypen has it fully. It's now being installed. We have put the hardware and the networking in over 100 facilities, and the actual software is now being installed on top of that. So other hospitals to follow will be Spanish Town, St. Anne's Bay, and it will continue rolling out. What this will do is link health centers, hospital, and captures the entire history of the patient. So one could easily assess that history. To the extent that there are gaps, those gaps will be filled with the overhauling of the system.
There is hope for new parents experiencing depression. For Phil, 1 year into fatherhood,
There were points where leaving for work, it was like, phew, I am child-free for this period. But right now, it's amazing. Like, I don't want to leave him alone. He is like my world. I am so in love with him. And I tell him I'm sorry like almost every other day. I just hope that he never knows that his dad was that person.
and Jamila Pinto.
I'm still getting back into myself, I'm a single mother as well too, so it's difficult having to navigate all of these things, not having the time. So slowly but surely, but I'm just thankful that I'm in a better position that I was in last year. And over time, I know that I will become consistent and disciplined.
Here's Janella.
Nothing is more satisfying than sitting on the couch, having a conversation with my now 6-year-old, just hanging out with her. I've sacrificed so much and I have no regrets. I always say to people, if you're going to invite me, if it's not child friendly, I am not coming.
Yeah, we fall and rise, fighting for all our life. All our choices not right, cause we not perfect, we have flaws and we not Christ.
You can follow the social media support groups at Caribbean CMFH and at BAM Moms Club on Instagram, taking you beyond the headlines with Tears of Sadness, Not of Joy, Peri and Post Natal Depression in Jamaica. I'm Deborah Gordon.